Happy Monday to you. This is Dr. Scott Gray coming to you from scottgraypt.com. And so today is Manual Therapy Monday again, and I want to talk in particular this episode about the subcranial spine. So the reason why we're talking about the subcranial spine is because usually this is where the lack of rotation in your patients is coming from. So in the past few weeks we've been talking about the mid-cervical spine, which is all good and dandy, but the majority of the time the motion is limited at the atlas axis joint, which is C1 and C2. So in these next few videos we're going to talk about the biomechanics, we're going to talk about how you should assess it with your patients, and last but not least, I'm going to show you how you can treat it. So stay tuned for the next few videos. Alright, so now that we did a quick introduction, we're going to talk about the functional biomechanics of the subcranial spine, in particular the atlas and axis. We're going to save our OA joint for another time, but we're going to go over the AA joint. So all you really need to know in regards to the AA joint is that wherever my head goes, my atlas goes. So for instance, if I bend my neck forward, my atlas is going to glide forward. If I bring my head back, my atlas glides back. If I side bend right, my atlas glides right. If I side bend left, my atlas glides left. Now this is where it gets a little bit tricky, is when I rotate right, it's going to glide back left, which we'll go over here in a second. And if I rotate left, my atlas is going to glide back to the right. And so if you remember off my prior videos talking about the mid-cervical mechanics, if I side bend my neck right, I get a up glide on the left and a down glide down and back on the right. And so if I keep, my body wants to basically keep its eyes on the horizon. So if I side bend right, everything from C7 up to about C2 is going like this. And it's also going to rotate a little bit. And so, that's because the cervical mechanics are the same for side bending and rotation, by the way. So if I side bend this way, everything's kind of going this way. But to keep my eyes on the horizon, my atlas has to rotate back to the left. So anytime you side bend right, your atlas is going to rotate left. And you'll see this in your evaluations when you have your patients do their active movement screen. When you have them side bend, if their eyes want to fall down to the right, you should be licking your chops and thinking that that atlas isn't rotating back to the left. Similarly, when I rotate my neck to the right, I'm going to get that glide back to the left. So those are really the take-home points when you're evaluating and treating from the biomechanical standpoint of the atlas and axis of the subcranial. So now that we went over the biomechanics of the subcranial spine, I'm going to show you a quick little active range of motion movement assessment, and then we'll get into some accessory things that we can do to check to ensure that the AA is moving optimally. So typically, the AA is the number one rotator, or about 50% of your rotation comes from your AA, or C1, C2, and the rest of it comes from the mid-cervical spine. So you primarily want to check rotation, but don't forget that the subcranial spine at AA also has a little bit of side bending in it. Because remember, when it rotates right, I got to glide back left, and so I got to check that side bending too. Flexion extension really isn't that important per se. It's more of the OA joint. So in this case, we're really going to kind of stick to the transverse plane and the frontal plane motion of the neck. So if my patient came in, I would have him rotate right, and I just kind of want to see where he would be at, and then I'd have him rotate left and kind of compare, right? And so if we're playing devil's advocate here, typically in rotation right deficit, he would probably get to there, and I might be thinking it could be mid-cervical spine or it could be subcranial spine at AA. And so another way you can really weed this out is when you side bend to the left, the atlas, if you remember correctly, is gliding left because the occiput's going that way, but he also has to rotate back to the right. So if I took him through that side bending test and his eyes kind of deviated down that way, I'm probably thinking more AA in that regard. And so you just obviously want to compare left to right, and it's just a small motion here at the subcranial, so you don't have to go through these super big excursions, but you can definitely get some insight from that. So now we're going to go ahead and transition into the supine assessment, which is probably the best part of where you're going to be able to discern, is it AA or mid-cervical. Alright, so now that we went over the biomechanics of the the subcranial spine, we're going to go ahead and show you how to assess and evaluate it. So with your patient laying down on your back, we want to just basically kind of recheck those motions. So I might do some rotation, kind of get a sense of an end feel here, and then rotation left. And I also want to do side bending. And what you don't really want to do is flexion or extension, because that's primarily going to be your OA joint. So particularly we want to really work on the transverse plane and the frontal plane of rotation and side bending. So if I rotate Patrick to the right, if he was limited in rotation right, the subcranial spine, theoretically this would kind of show up here. Now I can also, when I'm rotating his neck to the right, palpate here off of the C1 transverse process. And if you remember off the last video, that atlas is going to glide back to the left. So even though he might be limited in rotation, it can also be that the atlas isn't gliding back to the left. So I just want to get a sense of feel for that. And I feel him kicking it in my hand, okay? So similarly I can do that to the left as well. And then I can also check that rotation limitation is by side bending his neck and locking out the mid-cervical spine, and then rotating him back to the left, as you can see here. And so he feels pretty good there. Same thing, I bring him back all the way to the left, and then rotate him back to the right. And so usually this is what will be the #1 test to really discern if that atlas and axis joint, AA joint, is limited in rotation. So another thing you can do is check the side bending of the atlas and axis. And if you remember again from last video, if I side bend his head to the right in that small motion, the atlas is going to shoot out that way. So I want to put my finger on the TP here of C1 and just kind of feel for that atlas come into my hand. Now I can also kind of come off to the side here again on the left and do the same thing. And keep in mind, when I'm doing these motions of the subcranial spine, they are small, they're subtle, they're not, you know, this big massive range of motion. It's just this little itty bitty motion. So give that a try and use those to kind of help discern if your patient is limited in the frontal plane with the atlas not gliding left or right, or if it's a rotation limitation with the side bending and rotation away test. Alright, so now that we've evaluated our patient and we kind of really figured out what is going on and what's wrong with them, we can treat it. So basically we're just going to do kind of the same test for the most part. So for instance, if my patient was limited in right rotation, but it was because the atlas wasn't gliding back to the left, I would want to side bend my patient to the left. And I'm going to kind of stabilize the occiput here. And I'm using my right hand here just to basically kind of push the atlas on this C1 transverse process back to that way while I kind of squeeze back with my left hand. So my left hand is squeezing into my body and Pat's head here. There's a little bit of stabilization and counterforce. And then I'm just going to glide that atlas back to the left. And so again, that would improve left side bending, but also rotation back to the right. Now I can also do a grade 5 manip here of the atlas and axis, but I'm going to save that for next week. So Pat, why don't we go ahead and sit up here and we're going to show them a different mobilization. So go ahead and turn that way for me, Pat. And so from here I want to basically block C2. So I am having Pat just flex down to where I find C2. And then from here, we're going to rotate him back to the right. And so if you remember, the C2 spinous process is going to kick back to the left. So I'm going to put my thumb on the left side of the C2 spinous process. And then from here, I can just come right around the corner here and hold on to his head, and he's just going to rotate to the right while I block C2 and take out the slack and kind of put a little tension, bring him back in and out. And so that's how you would mobilize the atlas on the axis, just by blocking C2. So go ahead and give these mobilizations a try with your patients. And if you haven't already, please go to my website, scottgraypt.com, and download my physical examination blueprint, where I talk about different strategies for exercise and different assessments that you can use right away with your patients.